We're going to start video assessment 3 with the inspection of the skin. We're looking for any striae, an even vascular pattern on both sides. We're also looking for any abdominal bulges, hernias, or masses, which there are none. Then we're going to move on to auscultation of the abdomen. We're auscultating for bowel sounds starting in the right lower quadrant. Bowel sounds are noted to be an irregular gurgling. And there are bowel sounds auscultated in the right and left lower quadrant, left upper, and right upper quadrant. Next, we're going to auscultate the aorta, so we start by locating the xiphoid process and put the bell of the stethoscope. And then we move to the left of midline and the right of midline in order to auscultate renal arteries. Midclavicular line below the umbilicus for the iliac, and in the groin for the femoral. Next, we percuss. We're going to start by percussing the liver. We're going to percuss and measure at the same time. So we're going to start out with third intercostal space at right midclavicular line. Percussing, we should hear resonance over the lungs and dullness when we reach the liver border, and we'll mark the area. Then we're going to go to right midclavicular below the umbilicus, and when we percuss the abdomen, we should hear tympany unless we're over an organ, and then we'll hear dullness. So we're going to percuss upward until we hear dullness, and we're also going to mark this. Normal liver should be anywhere from 5 to 9 centimeters. So our measurements here are 8.5 centimeters from top to bottom border. Next, we're going to percuss the spleen. So from the right side of the patient, we're going to reach our left hand underneath the patient's flank area, lift up, and have the patient take a deep breath while we percuss on the left side, and we should hear dullness between the 6th and 10th intercostal space. Next, we're going to palpate the liver. For liver palpation, we'll put our left hand underneath the patient under the 12th rib, lift up. We're going to take our right hand right under the rib cage and push inward underneath the rib cage as the patient takes a deep breath. Taking a deep breath has the diaphragm push the liver down. Do you have any pain? Okay. We're going to palpate the spleen by putting our hand on the underneath the left flank again, putting our right hand on the costal margin, having the patient take a slow deep breath in order to move the spleen anteriorly and inferiorly. In a normal sized spleen, we should not palpate anything. In order to palpate the kidneys, we would put our hand on the flank of the patient. I'm going to stay here on the left side, and we will do deep palpation around the costal margin. Normal kidneys are not palpable. Next, we are going to we're going to do his range of motion, musculoskeletal. So stand up. Alright, here we go. Have a seat. Okay, we're going to start out by looking at his bones his musculoskeletal system, arms, legs. We're checking for symmetry, contour, which all are normal on both arms and legs. Next we're going to do neck range of motion. So I need you to bend your head forward. Hyperflexion backwards. Turn your head to the right. Turn to the left. Now put your right ear on your right shoulder without pulling your shoulder up. And again on the left side. We're going to test neck range of motion. I'm going to hold my hand on his face and he's going to turn his head towards my hand. That's testing the sternocleidomastoid muscle. We're going to do the same on this side. And we're also going to do for the forward flexion, I'm going to put my hand on his forehead and have him push forward. And for the backward hyperextension, we're going to do backward. Okay? If you can stand up. We're going to do shoulder range of motion. So first we're going to start with forward flexion. So I'm going to have you put your hands down and push them forward, which should be 180 degrees. Turn. Now we're going to push backwards, arms backwards, which should be 50 degrees. Turn back towards the front. We're going to have you put your arms out to the side and lift them up over your head. He has a left rotator cuff tear. Therefore, this is as far as his left arm can go without pain, so we're not going to go any further. And this is abduction of the shoulders. And going inward, one hand at a time, towards the midline. This is adduction, which should be roughly 50 degrees on either side. To do internal rotation of the shoulders, we have the patient clasp his hands behind his back and move his arm backwards. Here's internal rotation. And then we're going to have the patient put his arms, clasp them behind his head, which, oh, you can do that. And that is external rotation. Okay. Now in order to test the strength of the shoulders, which is also testing the strength of the elbows at the same time, so when we get to the elbows we'll skip the strength portion, I'm going to have the patient bend his arm, and I'm going to put force attempting to straighten the arm as he attempts to keep it bent. Okay? And now we're going to do the same where I'm going to try and keep it straight and he's going to attempt to, I'm going to attempt to bend it and he's going to attempt to keep it straight. Okay. Next we're going to move to the elbow, and for elbow range of motion, I'll have him put his hands out. Oh, it's the same, it's bend up. So I need you to put your arms out at your sides, have your hands touch your shoulders, and put them back down. And can you turn backward and forward? Thank you. And like I said, the strength tests for the elbows are the same as they are for the biceps. Next we're going to move on to the wrists, so if I could have you stick both hands out. We're going to have you do flexion upward, flexion downward, radial deviation, which is inward toward your thumbs, and ulnar deviation, which is outward. Thank you. I'm going to have you stretch out your fingers on both hands, squeeze them in, make a fist. Okay, I'm going to have you attempt to, for strength of the wrist, I'm going to try and push your hand up and you push it downward. And I'm going to try and push it down as you push it upward. Okay, I'm going to try and there you go. I'm going to try and push your fingers together. Okay, can you put your fingers together? And I'm going to attempt to pull them apart. Okay, we need to feel the joints. Shoulders, elbows, wrists. We're looking for any swelling or any skeletal abnormalities. We're going to do the wrists, the hands, as well as the fingers. Okay, next we're going to move on to the hips. So I can have you lay back down. For hip range of motion, I'm going to have him, with his leg extended, lift his leg upward, and that should be at about a 90-degree angle. I'm going to have him move his leg laterally, which is towards me, and medially, which is towards the center line of his body. I'm going to have him put the heel of his right foot on his left knee, and external rotation, which is towards me, internal rotation, which is toward his midline, and if you repeat that on the other side. Thank you. Okay. To test strength in the hips, we're going to have him keep his legs straight. I'm going to hold my hands on his thighs and have him lift both legs. Okay. Now I'm going to put my hands on the outside of his legs and have him push his legs outward. Okay. And now I'm going to put my hands on the inside of his legs and have him push his legs inward. There we go. Okay, next we're going to do the knees. Sit down. Okay, for knees, we're going to have him flex, straighten, and then extend them, which is, there we go. And for strength, I'm going to try and hold his legs down while he pushes outward. And I'm going to try and hold his legs straight while he bends them. And that tests knee strength. Now we're going to move to the ankle. So for ankle range of motion, I'm going to have him test dorsal flexion, which is pointing his feet upward. Plantar flexion, which is pointing the feet downward. And then we're going to do inversion, which should be about 30 degrees. That's moving the lateral part of your foot inward towards the ground. And eversion, which is pointing the medial side of your foot outward, which should be about 20 degrees. In order to test strength in his ankles, I'm going to push up on his foot as he's pushing down. And now I'm going to push down as he pushes up. Great. Okay, next we're going to do thoracic and lumbar spine. You can stand up. I'm going to have him turn laterally to the right, so you can bend towards me, and laterally to the left. We're going to have him rotate his hips towards me and towards the left. I'm going to have him, if you can face the fireplace, do backward hyperflexion towards me. Okay, now I'm going to have you touch your toes. Okay, and as he's bent over, I'm going to check his spine for any abnormalities or any signs of scoliosis, and there are none, so you can stand up. Okay, next we're going to do heel-toe gait. What we're going to have him do is walk facing forward, facing the cameraman. We're going to have him walk heel-toe. And here we're looking for any muscle weakness, any neurological deficits that may cause him to lose his balance or be unable to perform this test. You can walk back. Anything else that could askew this test would be any drug or alcohol inebriation. Okay. Now we're going to do the Romberg test, which tests cranial nerve number 8. And this test is him closing his eyes. And I'm going to give him a light nudge to see if he loses his balance. And he keeps his balance just fine. The next test we're going to perform is the rapid movement test. So what I'm going to have you do is put both hands out. And if you could flip them palm up, palm down in a rapid fashion. Thank you. And we're also going to do rapid movement of the lowers. So we're going to have him take his right heel, place it on his right knee, and slide it down his shin. And, yep, and do opposite. There we go. Now we're going to do we're going to test his finger to nose, see if he can close his eyes, and put his finger to his nose on either hand. Again. Okay, now we're going to test stereognosis. And what that entails is him closing his eyes And I'm going to place something in his hand, and he should be able to identify what it is by simple placement.
Battery.
Battery, that's correct. Alright, we're going to test the left hand as well.
Nail polish.
Nail polish, correct. Okay, next we're going to test graphesthesia, which is his ability to identify what I'm writing on his palm with his eyes closed. So I'm going to write something and he's going to voice what I'm writing.
An M?
That's right. I'm going to do his left side.
An L?
And L. That's correct. Now we're going to do soft versus pain. So what I'm going to do is I'm going to have him close his eyes, and I'm going to use my soft and my pain, and he's going to voice which one is which by me touching his skin.
Soft. Pain. Soft. Pain.
Okay. Now we're going to test his positional. So what we're going to do is I'm going to have his foot out. I'm going to use his great toe, and I'm going to position it either forward towards the camera or backward or outward, and he's going to tell me which one it is. So forward is towards the camera, backward is towards you. Okay, you ready?
Back. Forward. Out. Forward. Back.
Okay. Next, we are going to test his reflexes. So for reflexes, we're going to start with the biceps reflex. So I have to support his elbow with my non-dominant hand, push my thumb, I need you to relax, push my thumb into his bicep tendon and hit the pointy end of the reflex hammer on my thumb, and his hand as well as his lower arm and bicep did a jerking movement. Next, we're going to test the brachioradialis, and we have the hand in a supine position, resting, and we go approximately 3 inches above the radius and use the pointy end, and we should see his hand flex. Okay. Next we're going to do the tricep reflex. So I'm going to support his arm, relax, put my hand, my finger, and hit right above the olecranon process, and his tricep should twitch with some lower arm movement. Next we're going to test the patellar reflex. So we're going to have him relax his arm. We're going to relax his leg, locate his patellar and use the wide end of the reflex hammer and hit just below. And we should see a slight jerking movement in his lower leg. And for ankle reflex, we support slightly, have him dorsiflex his foot, flex the knee, support the bottom of the foot, locate the Achilles tendon, and with the wide angle of the reflex hammer, we're going to hit the Achilles tendon, and there should be a jerking movement in the toes as well as in the lower leg. If you can give me one moment just to locate my tuning fork. With the tuning fork, we're going to do his vibration sense. And what we do is we activate the tuning fork, place it on the top of his toes, any bony prominence. And he needs to tell me when the vibration starts and when the vibration stops. I can start distally, and if he's correct with the amount of vibration, I do not have to go up any further. But if he does not feel it, I do have to hit other bony prominences such as the knee, the wrist, or the elbow. So we're going to start with the foot.
Feel it.
He says he feels it.
Stop.
And it did in fact stop, so there's no need for us to go any further. We also need to test with the wrists and the fingers, which I did forget, is to have him touch the tip of his thumb to each finger. So if you could do that, that would be great. Thank you. That concludes our video.